Good morning. I'm calling this meeting of the Taxes Committee to order for April 20th, 2023. First item of business on the agenda is approval of the minutes from yesterday, April 19th, 2023. They're a little longer than normal, I think. Representative Norris, have you had a chance to review them?
I have, Chair Gomez, and hat tip to Ms. Savas for, I think, accurately capturing that oral amendment yesterday. So I will move the April 19th minutes from the Tax Committee.
Excellent. Vice Chair Norris has moved the minutes from April 19th. Is there any discussion to the motion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed, please say no. Motion carries. The very, very long minutes from April 19th, 2023 are adopted. Excellent job, Ms. Savins. All right. So first up on the agenda, we have House File 2. Welcome back to the committee, or I guess you have been in property taxes before, but welcome to the committee, Representative Richardson. I'm going to move that House File 2, the fifth engrossment, be re-referred to the Ways and Means Committee. Representative Richardson, to your bill.
Thank you, Madam Chair. And I do have an A52 amendment to get the bill in the shape that I'd like.
Absolutely. Thank you. Chair Richardson, I'm sorry. Oh, I have Chair Richardson on my thing, but Representative Richardson, thank you. So I'm going to move the amendment coded A52. Do you want to describe it, or we could probably go to staff to describe it if you'd like?
Thank you, Madam Chair. So the Paid Family and Medical Leave Program is funded through a 0.7% premium that can be split between employers and employees. And what this amendment would do, it would provide some support to small businesses based on the size of their payroll through a reduction in the employer side of the premium. So employers with fewer than 30 employees would not have to pay premiums on the first $50,000 of wages per year for employees, and the wage exclusion would be capped at $480,000. And then for each employee between employee 21 to 30, the wage exclusion would be reduced by $48,000. So it's sort of a graduated tier to provide some relief to our small and micro businesses.
Excellent. Thank you, Representative Richardson. Is there any discussion to the A52 amendment? Representative Robbins.
Thank you, Madam Chair. Thank you, Representative Richardson, for bringing this. We are looking to help small businesses because we're very concerned about this bill. So I'm just a little confused about, so how will the cost of this be made up? Is it through the general fund, or how is this cost reduction for small businesses being made up on big businesses? Where is it coming from?
Representative Richardson.
Thank you, Madam Chair, and thank you, Representative Robbins, for the question. So the premium relief that would be provided within this bill, it would be subsidized not only by the funds that are being allocated for this bill. There's $1.7 billion that is currently within this bill in terms of getting the program up and running, and also just thinking about the pooled risk of the program, it would be shared across the state.
Any further discussion to the A52? Representative Brand.
Thank you, Madam Chair. To the author, Representative Richardson, thanks a lot for working to get something like this into this actual legislation. I think this actually makes it stronger. You and I have talked after Workforce about how we can do something like this. Our micro businesses, our businesses in Minnesota, they pay taxes. They do great jobs. We're talking about people that have a vacuum in the back of the car. They clean an office building after their regular job is over with. There are a lot of folks that have secondary jobs in the state right now just to make ends meet, and there are a lot of people also that this is their main business, and so we're protecting everyone in this. Small businesses, as I talked about in Workforce, we do a lot to feed people into the pipeline of the workforce, but we don't do enough to encourage entrepreneurship. This is an opportunity for people to say, I can take a risk knowing there's a safety net. If something goes wrong and I fail, I've still got a safety net. If something goes wrong in a person's health or somebody in their family gets sick, like a lot of people do, there's a safety net. And so having a small business, starting a small business, having a micro business shouldn't mean financial ruin. This is an opportunity to save a lot of people in the state from that financial ruin. Thank you.
Representative Robbins.
Thank you, Madam Chair. Just a quick follow-up. So I didn't see anything in the fiscal note addressing the A52 or maybe an updated revenue note. Is there a fiscal analysis of this yet?
Representative Richardson. Sorry, we can go to fiscal staff too if you need. Oh, Cynthia, Ms. Templin, sorry.
Madam Chair, Representative Robbins, the A52 is an amendment that has not been included in the most recent update of the fiscal note that you have before you. And a revenue estimate is also, should also be distributed soon. That is, it does not include the A52 amendment either.
Representative Robbins.
Thank you, Madam Chair. I mean, I think, I don't want to shut down debate, but at some point, I think we should table this bill. We are really not ready to deal with this if we don't have the revenue note or the updated fiscal note. Like, I believe we're the last stop. Am I correct? Oh, Ways and Means.
The fiscal committee will hear the bill next.
So I don't want to stifle the debate, but at some point, I'll probably move to table. So.
Representative Richardson.
Thank you, Madam Chair, and thank you, Representative Robbins, for raising your questions. I would just note that this is language that has been worked on within the Senate as well, and so there is data and around the fiscal costs related to this, and DEED's ability to be able to coordinate this as well.
Thank you. Representative Joy.
Thank you, Madam Chair. I guess the question I have is, Representative Richardson, how did we come up with 30? I mean, is that just a number we came up with 30 or just felt that that's the strong end of number or how did we collectively come to that?
Representative Richardson.
Thank you, Madam Chair. So in terms of this bill, it really is in response to many asks to ensure that we are providing some safety net for our smallest businesses. One thing that I just want to clarify as well, business size is not a proxy for revenue. And just because a business is small does not necessarily mean that that they have the lowest revenue. You can look at law firms, you can look at small doctors' practices as well. And so what this is really looking at doing is looking at some of the smaller businesses within the state and creating a graduated sort of relief process that is based upon the average wages so that we could try to target the micro businesses.
Representative Swedzinski.
Thank you, Madam Chair. And just I would ask Representative Richardson. You said that some of this language actually exists, and there are financials out there. Where are they? This is your bill. You're before a financial committee. You said that there's some finances around this. It's been around in the Senate or something. What are those numbers?
Representative Richardson.
Thank you, Mr. Chair, or thank you, Madam Chair. Deputy Commissioner Rowe could speak to some of the work that has been done on the Senate side.
Excellent. Welcome to the committee. Please introduce yourself for the record as you get started answering the question.
Thank you, Madam Chair. Members, my name is Evan Rowe. I'm Deputy Commissioner of the Department of Employment and Economic Development. This provision is already in the Senate file, SF2, and we have submitted language to calculate the fiscal impact of this small business wage exclusion, and I believe it's either signed off or imminently being signed off on by LBO. So we have calculated that, and I can speak. Our calculation is that it's roughly about $44 million of impact, which is there is sufficient headroom within the existing premium collection to accommodate that.
Representative Swedzinski.
Thank you, Madam Chair. Representative Richardson, you said, I believe, that the total exemption was $480,000, but it appears here it's on line 1.17, number 2, it's $120,000. I'm trying to put those two things together.
Representative Richardson, or is there somebody else who should?
I don't know.
Do you want?
I don't know what the question is.
Sorry.
It's okay. Ms. Fitzpatrick, please introduce yourself.
Thank
for
you.
the record.
Hi, Chair Gomez, members of the committee. My name is Deborah Fitzpatrick. I'm the Director of Policy and Research at Children's Defense Fund Minnesota. Led the research team that conducted the design and implementation study under contract with DEED. The 120 is per quarter, so the 480 is the 4 quarters, adds up to 480 over the course of a year.
Thank you. Representative Swedzinski.
Thank you, Madam Chair. Thank you, members. And just a general other, on line 1.13 of the A52 amendment, for employers with fewer than 30 employees, I guess it seems like an odd number because in other areas of state law, we often have what is considered a small business. Why are we creating so much confusion where, if you're applying for a grant to Minnesota, you're considered small and vulnerable when you have 50 employees. But when it comes to this, as one DFL representative just said, dangerous precedent and potentially put businesses at risk by not doing this, why would we do it at 30 compared to 50?
Representative Richardson.
Thank you, Madam Chair. And again, I just want to lift up the reality that just because a business has less than 50 employees, it doesn't necessarily mean that it's vulnerable. And I think the discussion is more nuanced than that, which is what this amendment seeks to address. And with the modeling that has been done, I'd also like to have Ms. Fitzpatrick speak to that because there is a lot of modeling that has been done as well.
Excellent. Ms. Fitzpatrick.
Thank you. Thank you, Chair Gomez, Representative. I think the 30 really falls in many ways. We've really looked to other states to see how they have done various policy elements. One of those is a support for smaller businesses, and this really falls kind of in the middle among states. Some states provide relief for 10 and under, some for 20 and 25 and under, and so I think we see this as being, again, in line with where other states are at, and kind of in the middle of the pack, which is how we've tried to design the policy in general.
Thank you. Representative Swedzinski.
Thank you, Madam Chair. And just a kind of a follow-up to that comment. You said that you chose 30 because it's kind of in the middle of the pack. What were the reasons for those different numbers in those states? Why they had those exemptions? What reasons did they give?
Ms. Fitzpatrick, I don't know if you have a comment on that, but.
I mean, I don't. I mean, I think
Yeah.
it's just an analysis of kind of where, where the need lies and how that's balanced against some of the questions that were raised earlier about how this is a socialized cost that's spread across the entire rest of the employer population as well as the rest of the worker population. That is, this is a self-funded program in the long term, and so I think it's a balancing act of finding a right spot to provide relief, but also not, negatively impacting the rest of the premium payers.
Thank you. And I think that those, state-by-state analyses are something that we often call on here in the legislature when we're developing policy and, digging back into legislative intent of the, 11 or 12 states across the country who have implemented this is maybe not within the kind of scope of the research, but we appreciate sort of that you guys did take a look at that and kind of put us somewhere in the middle. Representative Swedzinski.
Thank you, Madam Chair. Just, of those 11 states, Madam Chair, it'd be interesting, what are those exemption levels in those other 11 states? Do we have exact numbers in what states? I mean, we don't have a fiscal note. We don't have, a lot of the basic thing that a finance committee would do. We are that, and so we have to ask some of these questions. It's the first time we've gotten a bite at this sour apple. And we just want to know.
So Representative Sudzinski, there is a fiscal note in your packet, of course.
This amendment?
No, I'm saying for the bill overall, Representative Richardson. If you had any comment on that. Otherwise, we need to get to voting on the amendment. We'll revert to that after Representative Richardson's comments.
Yes, thank you, Madam Chair. So you're correct. There is a fiscal note, and as Deputy Commissioner Rowe stated as well, there has been cost estimates that are underway on this as well. And I think it's important to note that this bill has gone through several amendments in terms of the concerns that we have been hearing. There were concerns that were articulated around how this would affect small businesses, and this is an answer to that.
Thank you very much, Representative Richardson. We're going to move to the consideration of the amendment. We have a time constraint. We'll go to Representative Robbins briefly, and that's it. Then we're voting. Representative Robbins.
I just wanted to move to table it now that we've had the discussion, Madam Chair.
Representative Robbins has moved to table the bill.
And roll
All those
call.
in favor, please say aye.
She requested a roll call, Madam Speaker.
Excuse me?
Or, Chair.
I'd already called for the vote before I heard anybody request a roll call. All those in favor, please say aye.
Aye.
All those opposed, please say no. No. The motion does not prevail. The bill is not tabled.
Madam Speaker, I would request that we reassess that vote and that we take a roll call on that reassessment of said vote to table the bill.
I don't know what a reassessment is. I don't know if that's like reconsider. I don't know if that's a thing.
I think reconsider and reassess are very similar vocabulary words, Madam Chair. Very similar.
Literally didn't say that. I'd already called for the vote. I'm not trying to be a jerk. I just all right, so we're gonna reconsider the motion to table and do a roll call on it. So Ms. Sabis will take the roll.
Chair Gomez.
Gomez, no.
Chair Gomez, no. Vice Chair Norris.
No.
Vice Chair Norris, no. Lead Davids excused. Representative Agbaje.
No.
Representative Agbaje, no. Representative Anderson excused. Representative Brand.
Brand votes no.
Representative Brand, no. Representative Elkins. No. Elkins, no. Representative Howard.
No.
Howard, no. Representative Joy.
Aye.
Joy, aye. Representative Koznick.
Haziq votes aye to table.
Koznick, aye. Representative Lee. No. Lee, no. Representative Listlegard.
Yes.
Listlegard, aye. Representative Olson B.
Yes.
Olson B, aye. Representative Olson L excused. Representative Pinto.
No.
Representative Pinto, no. Representative Robbins.
Aye.
Robbins, aye. Representative Smith.
No.
Smith, no. Representative Swedzinski.
Aye.
Swedzinski, aye. Representative Weiner.
Yes.
Weiner, aye. Representative Whitty.
Aye.
Whitty, aye. Representative Uakim.
No.
Representative Uakim, no. Madam Chair, there being 8 ayes, 10 nays, and 3 members excused.
There being 8 ayes and 10 nays, the motion does not prevail. The bill is not tabled. To the A52 amendment, I'm going to renew my motion, or renew my motion that we adopt the amendment coded A52. All those in favor, please say aye. Aye. And all those opposed, please say no.
No.
The amendment or the motion prevails, and the A52 amendment is adopted. All right, Representative Richardson, to your bill as amended.
Thank you, Madam Chair. House File 2 as amended establishes a statewide family and medical leave benefits program and would be a safety net for families who need to take time away from work to care for a new child, care for a sick family member, or to recover themselves. I want to take a moment to lift up the incredible amount of work that continues to happen around this bill with engaging with groups representing employers, business owners, the insurance and construction industries, state agencies, city and county considerations, social service organizations, and families. This bill reflects many voices as we work to make it better for employers, including those interested in offering private plans, while we also work to ensure there are strong protections for workers. The United States is the only country without a paid family leave policy among high-wealth nations. The rest of the world, including low-income countries, offer paid leave. We are also an outlier when it comes to paid medical leave. Research consistently shows across race, gender, economic status, age, political affiliation, there's support and strong support for a comprehensive paid family and medical leave program. Nationally, 70% of small businesses support a publicly administered paid family leave program. It is also incredibly popular across party lines, as 84% of voters support paid family leave programs. Research also shows that there's costs of inaction on paid leave programs. Over $22 billion of lost wages annually occur within the United States as a result of this failure to provide paid leave. Also recognizing the very real war on talent, it's important to understand what the research states on consumers' views of states with paid leave programs. 61% of adults who say they plan to move in the next 2 years would be more likely to move to a state with a paid leave program. Paid leave is one of the top 3 policy provisions people prioritize when considering a state for relocation. Gen Z and millennials especially prioritize paid leave as the most important policy consideration for relocation. What is ultimately at the heart of this bill is a recognition of universal humanity. A recognition that at some point we or our loved ones are going to need time to bond, to heal, to recover, or navigate providing care for a loved one with a serious health condition. While we all face those crossroads, we know this current system design has created an inequitable and uneven safety net. The ability to care for yourself or your loved one is a basic human need, and it should not be denied to you because of where you work, the size of your employer, the color of your skin, your gender, who you love, or your zip code. Our current system design reinforces the notion that only some are worthy of care. Only some are worthy of rest to recover or to have time to care for their families. This bill will reject that harmful narrative and to begin to build a long overdue, more inclusive safety net. And with that, Madam Chair, I'd like to turn it over to my testifier, Ms. Fitzpatrick.
Excellent. Thank you, Chair Richardson, or Representative Richardson. Welcome back, Ms. Fitzpatrick. Please go ahead with your testimony and introduce yourself again for the record.
Yes,
if you don't
thank
mind.
you. Thank you, Chair Gomez, members of the committee. Again, my name is Deborah Fitzpatrick. I'm the Director of Policy and Research at Children's Defense Fund, Minnesota. In my prior role at the University of Minnesota, I led the research team that conducted Minnesota's legislatively mandated design and implementation study under contract with DEED. I'll spend just a few minutes grounding the committee in the program structure at a high level and be available for questions later. So House File 2 sets up a statewide, publicly administered insurance program that is self-funded and sustainable over the long term through contributions from workers and employers. It allows self-employed people and business owners to join the program and employers to provide a comparable program. Eligibility is based on workforce participation. Again, really important to note, it's an earned benefit. Healthcare providers certify both the need for and length of leave in most cases. Much of the program is designed to build on Minnesota's successful UI processes, as well as the infrastructure developed and lessons learned in multiple U.S. states. Among design options, this one was chosen for a variety of reasons. I'll lift up just 3. First, it's a portable wage replacement benefit, which is especially important for workers with multiple employers or those changing jobs. Second, it creates the broadest possible risk pool, a feature necessary for keeping costs low and leveling the playing field among employers. And finally, it's the proven, effective, sustainable model that gives all workers an opportunity to earn and count on the benefit from year to year. And it makes the costs currently borne by both employers and workers more predictable. So the program provides up to 12 weeks for medical and up to 12 weeks for family leave, again, for serious life events lasting more than 7 days. And the experience from multiple states, as well as decades of U.S. Department of Labor surveys of employers and employees, shows that workers take what they need, and that is on average less than the maximum allowed, even when fully paid and employment protected. For example, in Washington, the entitlement is 12 to 18 weeks, and the average has been around 7. There's no evidence that Minnesota workers are less committed to their employers or coworkers or more inclined to abuse their benefits than those in other states. In fact, one could argue the opposite. House File 2 and Senate File 2 include 2 related components, wage replacement and employment protections with slightly different eligibility requirements. Wage replacement requires an earning history and an eligible event, and employment protections or right to return to your job require wage replacement plus 90 days with the employer from which your leave is being taken. House File 2 leave entitlements run concurrently with those under Minnesota's unpaid pregnancy and parenting leave law, as well as the federal FMLA. Finally, just wanted to note that the design of House File 2 sits squarely within the parameters of other states, with not a single major policy element that isn't matched or exceeded by other state programs. For example, 5 other states have combined leave entitlements that exceed those in House File 2. 5 states also have a similarly inclusive family definition. With that, I'll stop and be available later for questions.
Thank you very much, Ms. Fitzpatrick. So what we're going to do is go through the other testifiers who are present, and then we'll move to member discussion, and maybe at that time you'll rejoin us. Thank you so much. So we have several testifiers. First up, I have Renee Herskovitz, and then on deck would be Beth Kadoun. Is Renee Herskovitz here? Not seeing her. If she shows up, we'll get her back on the testifier list. Ms. Kadoun, welcome back to the committee.
Thank you, Madam Chair. My name is Beth Kadoun. I represent the Minnesota Chamber of Commerce. I'm also here on behalf of the United for Jobs Coalition. There should be a handout that you have that lists the 115 plus local chambers and statewide organizations also opposing House File 2. Over 80% of our members already offer paid leave in some form, but not as dictated in this bill. And that is why our members are telling us that House File 2 does not work for them, especially our small members, business members who do not need or want this mandate to compete. There are grave concerns over the expense and the workability of this program. Many employers are already very concerned on its implications to their workplaces, as they're already struggling to find workers, and they would need to find temporary workers as workers are taking this leave. I'll focus on the payroll tax of the 0.7% that's imposed on all Minnesota employers in Section 23. This will greatly increase the fixed cost of doing business in Minnesota, raising taxes by about $1.5 billion per year. And unfortunately, that is not the only tax increase Minnesota employers are likely to see this year, as you just passed your $2.3 billion tax increase in the House Omnibus Bill, plus over about $5 billion in just the transportation and housing bills. And it's certainly not, it is not a certainty that the payroll tax will remain at 0.7%. And the bill even accounts for this by allowing the commissioner to adjust the tax annually based on the solvency of the fund. That starts in lines 53.30. The payroll tax increase is a big possibility, as the actuary study will not be done until the bill is passed and would be due on October 2023. So we really don't know if the tax will cover the cost. Washington State has already seen their payroll tax increase, which is now at 0.8%. And they're looking at further payroll tax increases already and/or a general fund boost to maintain their solvency of their fund. And Washington actually has a less expansive leave of 18 weeks. Whereas Minnesota has a stackability one of up to 24 weeks each year, and a much higher time off and broader eligibility and benefits than many of the other 11 states that have adopted a similar program. Without modifications to the expansive scope and design, we expect the program to run into solvency issues and necessitating higher tax rates on employers and employees, not to mention the property tax increase that is likely to occur in order to cover the costs for the counties, cities, and schools, as they're also included in this new employer mandate. In its current form, House File 2 would impede Minnesota's competitiveness, undermine economic growth by adding another fixed cost to doing business to Minnesota's already high costs. There are other more targeted and sustainable approaches that the legislature should consider instead. Thank you for the opportunity to testify.
Thank you very much. Up next is John Reynolds.
Chair Gomez, members of the committee, thank you for the opportunity to testify. I'm John Reynolds, the State Director for the National Federation of Independent Business. We represent over 10,000 small employers in every corner of the state. While it may be the case that major elements of this program appear in other states' PFML legislation, the reality is that no other state that has that requires employers to share the cost of the premium or the cost of the program have such an expensive program design. They don't pick one of the longest leave durations. They don't, and one of the highest wage replacement formulas, which is what this program does. Other states generally pick a moderate number of leave weeks in total and a moderate number of, or a moderate wage replacement formula. Or in the case of Massachusetts, you pick a really long number of leave weeks and a very, very low wage replacement formula. And that's why we think that this is going to be one of the most expensive programs, both in terms of financial costs and workforce challenges in the country. In the 2022 fiscal note for HF 1200, which is essentially the same proposal as HF 2, the modeling showed there'd be about 198,000 users. The average user would take 6.6 of leave per year, and the average weekly payment would be $598. While there's a lot that goes into those underlying assumptions, determining the total annual PFML benefit payments is fairly simple. If you multiply the total number of leave weeks used and the average weekly payment to PFML users, you get the 2022 fiscal note's total annual benefit payment of around $780 million. The 2023 fiscal note is laid out a little differently. On page 11, it expects a little over $1 billion in benefit payments in 2023 dollars. This is based on the assumption that there will be about 204,000 users. The average leave length and the average weekly payment are not provided in this year's fiscal note. In a past committee, it was said the average PFML user income assumed in the fiscal note is the state's average weekly wage, which is $1,287 in 2023. In the bill's wage replacement formula, that works out to about $1,003 per week. In Washington's PFML program for fiscal year 2022, the average leave length per claim was 7.5 weeks. The average total leave per customer was 9.5 weeks. Washington's program offers a third fewer total leave weeks than HF2. The maximum weekly payment in Washington is 10% less than HF2, and the wage replacement formula is less generous overall. In Massachusetts' PFML program for fiscal year 22, the
Mr.
average...
Reynolds,
there's a
you're
time.
sort of at time, so we can
I'm
go
sorry.
through every city or state, if you could just kind of
Sure, I'll just
wrap us up here, that'd be great. Thank you.
Sure. In some, if the average weekly payment is $1,003 and the average leave length experience matches those in Washington or Massachusetts, the cost of the program grows dramatically, and the benefit payments change from $1 billion to anywhere between $1.5 billion and $2.5 billion. So we think there's a lot of work left to do on this bill. Thank you.
Thank you for your testimony. Up next is Caitlin Rogers. Welcome to the committee. Please introduce yourself for the record and go ahead.
Thank you, Chair Gomez. My name is Caitlin Rogers, and I am a small business owner. I'm an owner of Next Day Animations. We're a certified B Corp small business that makes explainer animations. I'm also here as a Main Street Alliance member. I met with Representative Uakin hello, on Monday as one of our 60 small business owners who took the day off of work on Monday to be here on our day of action in support of paid family and medical leave. At Next Day Animations, we have 20-some employees, and we do already offer paid parental and family leave. I didn't get how critical this paid leave was until I had kids myself, and I finally understood the intense challenges of those first few weeks of healing, nursing, and bonding. So we offer paid family leave because it's the right thing to do, but conveniently, offering paid leave is also good for business. These benefits have helped us attract and retain a talented workforce. In the last year, 5 people on our small team have had a baby, and nobody is left. Everybody has come back to work. I hear the argument that small businesses can't afford to chip in 35 cents for every $100 paid, and that is absurd to me. Our current options as small business owners are to provide no paid leave, which would actually increase our costs in terms of recruitment, hiring, and training. Or we can provide paid leave ourselves, which is what we've already chosen to do. And it would be far less expensive to pay into a plan like this than to shoulder the cost alone. For small businesses like ours, paid leave will help even the playing field with corporate employers. We will be able to invest what we save in growing the business and increasing compensation for our team. And most importantly, no one should be forced to choose between their family and their paycheck. Thank you.
Thank you for your testimony. Excuse me. Up next, I have Ashley and John Kennedy. And you guys can grab another chair from the table here if you'd like to both be offer testimony at the same time. Or maybe you need 2 chairs. I'm not sure. No.
Good morning, Madam Chair and committee members. My name is Ashley Kennedy, and my husband John and I live with our daughters in St. Paul. I'm currently a state employee working for the Minnesota Judicial Branch. Thank you for the opportunity to speak today in support of House File 2. On March 15th, 2021, after 72 hours of labor, our daughter, Blair Evelyn Kennedy, died and was born. At 31 weeks gestation, she weighed just 3 pounds, 8 ounces, and was 17 inches long. She had beautiful dark hair and gorgeous blue eyes, almost an exact replica of her 2 older sisters. We only had 4 hours with Blair before we had to say goodbye. There are no words to describe the pain of delivering a baby who will never come home. Since Blair's death, we have found an entire community of parents whose children have died at birth or in infancy. Many of these parents lack access to resources like paid leave to recover from childbirth and to grieve their children. This lack of leave is unconscionable and also dangerous to the health of the birthing parent. In my case, I ran out of sick time and asked to access my paid parental leave, leave that the Human Resources told me I could access as a state employee. Even though I was expressly told that I met all of the eligibility requirements for paid parental leave, the Judicial Branch denied my leave, stating that the unwritten intent of the policy is for parents to bond with their baby. The Judicial Branch has no policy for paid leave to recover from childbirth. So 1 week after Blair's funeral and just 3 weeks after her death in birth, I returned to work.
Morning, Madam Chair and committee members. My name is John Kennedy. Parents whose children die should not have to return to work just days after attending their child's funeral. Parents who are able to bring their children home should not have to return to work immediately either. Whether caring for yourself or a loved one, House File 2 will ensure that all working families in Minnesota will have access to paid family and medical leave. This benefits all Minnesotans, your constituents, employees, and employers alike. While Ashley's story is unique in that her employer, the Judicial Branch, has a paid leave policy, and Ashley was wrongly denied leave under that policy, many workers in Minnesota have no such benefit at all. Too many of our friends and family have had to return to work after pregnancy, childbirth, and the loss of a child because they are unsupported and financially unprotected. House File 2 is an investment in the health and well-being of the people of Minnesota. It will provide much-needed relief to families who suffer the real tax of a system that does not provide the basic support of paid family and medical leave. This bill is necessary to protect families, including those who experience child loss. Please consider the very real good that this bill will achieve. Thank you.
Thank you so much for your testimony and for sharing your daughter's story with us. We really, really appreciate it. Thank you. Amity Foster is the next testifier.
I'm so sorry.
Hi, my name is Amity Foster. I am an Isaiah member, and I live in House District 60A. I want to share why paid family medical leave is essential to me. 2 years ago, my husband had a pretty serious medical crisis. He was in the ICU at HCMC for 2 weeks, sedated and intubated. While he was there, he was also diagnosed with acute kidney failure, and he started dialysis. After he was extubated, he was in the physical rehab center for 2 more weeks. I remember when he woke up, he literally couldn't sit up or walk on his own. While I was there, I was also the only person who could visit him because of COVID restrictions. So at the time, I kept working. I thought the distraction of work would be nice, but I would come home, open my computer, and just sort of stare at my emails. Couldn't concentrate, couldn't answer simple requests. I started to get really angry at my coworkers for emailing me. I got very clear then, when people we love are sick, we need to be able to take care of them and ourselves. We lost 4 weeks of his pay. He's a tile maker. And while I'd like to say that I can take care of us with my salary, it was a big hit, and it piles up. When he came home, he couldn't go back to work fully for another couple of weeks, and then he was on dialysis for 3 days a week for the next year. Paid family medical leave is an investment into Minnesotans, making sure we're able to take time to recover and then thrive. And it isn't just for the people who are in immediate need. It's for caregivers and for family members. Our story is not unique. We need to be able to take care of the people we love and ourselves without fear of losing a paycheck or losing our job. We need a paid family medical leave that supports all workers. Thank you.
Thank you very much. Up next is Parvi Bhatt.
Thank you, Madam Chair. Thank you, committee. My name is Purvi Bhatt, and I'm here as a AARP volunteer. I live in Minnesota, in Plymouth, Minnesota, and I was raised in Minnesota, and I'm here to share my experience, which is a unique one. It's from the perspective of a child of an immigrant. I'm an only child, a working daughter, a family caregiver, a health economist, and a healthcare executive, and also a second-generation Indian American immigrant who cared for her aging parents until they died. This testimony is actually dedicated to my parents, Harshad and Rekha Bhatt, proud Minnesotans, first-generation Indian American immigrants who came to the United States in the early 60s, before the Civil Rights Act and before Immigration Act. Based on our family story and my expertise as an economist, I can appreciate these deliberations and my experiences, and with all of that, I still urge you today to pass the Paid Family and Medical Leave Act. My nearly 30-year experience as a caregiver began in 1998 when my father was suddenly diagnosed with early onset dementia, the same dementia that today Bruce Willis has. He was 58 and I was 28. As his illness progressed and the level of care he needed required both my mother and I to take leave from our jobs. Years later, our situation escalated when my mother's cancers reemerged, her cardiac and lung conditions worsened, and before I knew it, I became my parents' caregiver and they became my dependents. I had to reorganize my career priorities and help our family face our new reality. After my father died, my mom and I lived together until she passed away last year. I struggled, working remotely and isolated for 2 years, caring for my mom while sheltered in place due to the pandemic, like many of us were. Finding vaccinated, masked, and paid home health care workers to help me was very difficult. I finally had no choice but to take a long-term leave of absence. When there was no home health, I had to abandon spending quality time with my mom in her final days to ensure basic care. These decisions to prioritize care at home come with significant trade-offs. With no sibling or partner, I struggle and continue to struggle to protect my own income, health insurance, and retirement savings. I cobbled together limited time and flexibility to keep my career afloat while translating doctor's calls, navigating business travel, clearing up family confusion, and making critical financial decisions. For years, I managed our situation across cultures, languages, a Rubik's Cube of benefit plans and time off policies. Early in my career, I was pressured to prioritize work over family time, and I would have to remind my employers that FMLA existed to protect my job. What doesn't exist today is the pay that accompanies that. Later in my career, I received greater support from companies who knew my caregiving was part of my story. I know this flexibility is not offered to many caregivers who work, and that is why I'm here today. A version of my story is likely happening in each of your families today. We have to accept that. Each of us knows the selfless mother, daughter, sister, niece, or cousin who made a sacrifice for her loved ones. It's usually a she. I'm here to remind us that she does so at a cost. Women, particularly women of color, assume family care responsibilities so quickly and so often without support. When we step into care, we step out of the workforce without pay, and we deliver care without reimbursement. Somebody else gets that reimbursement. Family caregivers are the backbone of our care system, and it's a system we cannot continue to rest on with each family trying to figure it out on their own without help. Minnesota leads the way with world-class health systems, incredible global companies like the ones I've worked for, and the largest healthcare payers in the world. It's crucial we join the world now to provide paid and family medical leave. I urge you today to pass the Medical Leave Act. Our diverse tapestry in Minnesota who care for our loved ones are counting on you. Thank you.
Thank you very much for your testimony. Up next is Ileana Mejia. Welcome to the committee.
Hi, Chair and members of the committee. Thank you for allowing me to testify today. So my name is Ileana Mejia, and I work at the Minnesota Council of Nonprofits. We are a statewide association with over 2,300 member nonprofits across the entire state. Minnesota nonprofits play an important role in our communities by providing essential services, employing local residents, and improving qualities of life. We employ over 392,000 employees, and we have over 9,000 employers in the state of Minnesota. And our workforce sector represents over 14% of the workforce in Minnesota. We do support House File 2 because the current reality of the nonprofit sector is that we lost over 30,000 workers since 2020, and we still continue to struggle attracting and retaining critical talent. We collect data on the nonprofit sector, which helps us evaluate and advocate for the sector. And so as of last month, our data shows that about 66% of our membership have annual budgets under $1 million. And every 2 years, we collect data on salary and benefits in the sector. And in 2022, we found that 60% of our nonprofits with budgets between $500,000 and $1 million budgets between $500,000 and $1 million reported not offering any type of paid leave when an employee has a new child. And many nonprofits, especially small nonprofits, struggle with offering competitive benefits, such as paid family and medical leave. And most private insurance options are cost prohibited. Such small nonprofits usually do not have a dedicated HR staff, so the work of finding, buying, and implementing a paid family leave is beyond their management capacity. We recognize that this program is an additional cost for nonprofit employers. However, we're confident that the benefits vastly outweigh the cost. The program would allow cash-strapped employers to plan and offer this benefit at an appropriate cost to both the employer and to the employees. This would be a predictable expense for employers. And furthermore, MCN is committed to advancing racial and gender equity in our state, and as you've heard from other testimony, this legislation would do just that. So we ask that members vote for House File 2, and if you have any questions, please connect with me. Thanks so much.
Thank you very much for your testimony. Finally, Kayla Hughes.
Thank you, Chair and members of the committee. My name is Kayla Hughes, and I live and work in Minneapolis. I'm a mom of two, a 1-year-old and a 4-year-old, and a social worker that specializes in postpartum mental health. Every day I hear from my clients about their postpartum mental health struggles. Too often these struggles are exacerbated by inadequate paid family leave. My clients, like the vast majority of Minnesotans, especially those who are Black, Brown, and Indigenous, are faced with the impossible choice between losing a paycheck and bonding with their new child. Data from decades of research show that having access to paid family leave contributes to fewer low birth weights, higher rates of vaccinations, higher rates of breastfeeding, and improved health and mental health for parents and children. This data asserts that paid family leave is critical to improving parental and child health inequities. This work is also personal for me too. As a new mom, I struggled with postpartum depression and anxiety. I was fortunate to have access to 15 weeks of paid family leave through my former employer. Without this leave I was afforded, my mental health and bonding with my baby would have been jeopardized. Paid family leave is an opportunity for our tax dollars to be used to benefit all of us. And the privilege to access paid family leave shouldn't be an option afforded to only some Minnesotans. Thank you.
Thank you very much for your testimony. That's all I have for those who signed up. Is there anyone else present who wishes to testify on House File 2? All right, not seeing any, then we will revert to member discussion. Representative Joy.
Thank you, Madam Chair. You know, as we go through and listen to this, and we just listened to the last testifier, kudos to that employer. That employer gave 15 weeks on their own. They didn't have the government coming and telling them what they got to do. You know, when they choose that, you know, when I think of this bill, I think of competition, and I've been in small business competition my whole life. We create things in our company to attract employees and retain them. That's our job as entrepreneurs. That's our job as employers. We set budgets. If I offer too much things, I could bankrupt my company. That's not what I want to do. When the state comes and tells me how I'm going to do it, I can't get competitive. You know, if I offer my employees pay for their premium on their insurance, that's my choice. We're turning around and creating a new program with 407 new employees, and I just calculate out conservatively at $20 an hour, it's $17 million in payroll a year that the state of Minnesota has to take in. Where are we coming up with that? I mean, if you take 407 employees at $20 an hour, at $20.80 an hour, $17 million in payroll. It's being conservative. I mean, I just don't understand why Minnesota has to come down and tell employers that this is what you got to do. Let us be in competition. Let us create our businesses and do what we can do in Minnesota. This is not a good bill. Thank you.
Representative Richardson.
Thank you, Madam Chair. When I think of this bill, I think about the humanity of Minnesotans. And I think about the people who have testified here today that have talked about stories of loss and have talked about the ability to care for themselves and the ability to care for their loved ones as well. And I just want to also lift up that we are within a state with an uneven safety net right now. The people who are most likely to have access to paid family and medical leave are the people who are often most able to float a leave without pay. And the people who do not have access to paid family and medical leave are those who reside on the margins of society. And overwhelmingly, it's women, it's Black, Indigenous, Latinx, and other people of color that don't have access to this benefit. And the unfortunate history that we have here is that we were founded on uneven safety nets. And you can look through history and see how safety nets have not been extended. I would also just note that there is nothing that prohibits a business from putting together a more competitive plan. because within this bill, it provides an opt-out for an employer who would like to offer their own plan. And in other committees, I've heard from folks who have said, hey, my plan is better than what is offered here. There's nothing that prohibits that. But this is a move forward to ensure that we have a more even safety net that recognizes the humanity of everyone, not just some.
Thank you, Representative Richardson. Representative Olson.
Thank you, Madam Chair. To the author of the bill, I'm looking at this, and since this is a worker payroll tax, there's included in this. I'm reading about the taxable wages. If your employer is withholding from your paycheck in order to pay this tax, then that reduces your income essentially, very similar to Social Security. But then if I were to, so I'm working, they withdraw the money from my paycheck, and then I need to access this medical leave, and I'm receiving funds as a result of the payments that I've been making, then I also pay taxes on that. So the way I'm looking at this is I'm paying taxes on my initial wages that have been garnered from my employer, and then if I access this benefit, I'm also paying taxes on that benefit. Now, we have different tax laws regarding Social Security, and I, in fact, plan on using my Social Security some days, so I'm not so, disheartened by that withholding. But my question to you is that an unintended error, or are we that excited to tax working Minnesotans?
We're going to go to to Representative Richardson, but we did get a revenue estimate while we were sitting here, and so as at the bottom it does say that paid family leave benefits would be subject to the individual income tax, just like unemployment insurance benefits are subject to individual income tax in Minnesota. As we were discussing, this program is, or the mechanism of it is based on the unemployment system. And, I don't know that the studies have been done, but, the amount of benefits that are paid out are likely, if you're accessing them, are much higher than the amount that you paid in, which is the case with all of these kind of programs where, Social Security included, right? That we've had this conversation about whether it's double taxation, and the rate of withholding for Social Security is much higher, and Medicaid, right, is much higher than the rate of withholding would be for this. And there are all these studies that show that it's not actually double taxation, because the amount of benefits that's paid out is much higher than what any of us individually would pay in. But I will maybe, we'll go to Representative Richardson. I don't know, Cynthia or Ms. Templin, if you had anything that you wanted to add from the revenue estimate that we just got handed out. I mean, folks can read through it, but it's okay? Okay. Representative Richardson.
Thank you. Thank you, Madam Chair. And yes, I would just echo what you have said as this relates. The program is modeled after our unemployment insurance program. And in terms of the sort of the analysis that you just provided, when this is a benefit that someone is going to need, the whole point of this is to be able to pull the cost across the entire state to ensure that we have a more effective safety net for all. So I would just lift up your comments as well.
Representative Olson.
Excellent. So what I'm getting from that is we're looking for even a $10 bill in tax revenue from the Minnesota worker. Just some easy, quick math here. If you make $50,000 a year and you're paying your half of that payroll tax, that's about $175. And at the current, even with the first tier, that's about a $10 bill that you're paying to the state of Minnesota as taxes on something that you're not receiving. If you use it or not, you're not receiving that money. If you use it, yeah, you get it, and that should probably be taxed. But if you're paying this and you're paying taxes on something that you're not using, that cost increases exponentially. So instead of $175 being withheld, you're paying an extra $10 in taxes, so now that's cost you even more. And you may look at it and you may say $10 isn't very much, but Yesterday on the House floor, we had an individual who was talking about the registration tab fees, and he said, we're lowering your taxes in the last 5 years of your car's life, and that was lowering it by only $5 a year. This is increasing it by $10 per year. So if you're going to make an argument that saving someone $5 is important, you should also make the argument that costing someone $10 is twice as important as saving them $5. We're double taxing Minnesotans, the working Minnesotans of this state, the ones that we should be protecting and the ones that you're claiming that you wish to protect. This is something that's very easy to do. Just exempt that initial tax withholding. It'd be easy. But if you really want to tax Minnesotans, then just go for it.
Representative Richardson.
Oh, thank you. Thank you, Madam Chair. You know, this is an insurance program, and with insurance, we often pay for things that we may not see the value of it until we need it. We do that with car insurance, we do that with homeowners insurance, and we do that with the various other insurance products that are available. And the goal of this bill and what we want to do with this bill is to ensure that people don't have to choose between caring for themselves or a loved one and a paycheck.
Thank you. Representative Olson.
Thank you so much for the 30 seconds. This would be something that's really easy to do. We do things like with our 401k, that if you make a payment to your 401k, you don't pay taxes on it. We can make this very easy. If you're going to pay into it, which you're going to force Minnesota workers to do, just don't tax what they pay into it. It's so easy. It would take 45 seconds for our revisers to figure it out. 45 seconds. This would be so easy.
Representative Anderson.
Thank you, Madam Chair. I have two things. One, I have a question for nonpartisan staff on the fiscal note, potentially. But if the employer cost is deductible as an expense, which will lead to sort of a lower net income for the companies that are in this, which would be everyone probably. So was any of that taken into account? Because companies are going to be paying less to the state in taxes with this expense.
Mr.
Can anyone answer that?
Ms. Tipp.
Madam Chair and Representative Anderson, you have a revenue estimate before you, and that revenue estimate for House File 2 for the 4E, for the fourth engrossment, does show there is no direct state revenue reduction as a result of the bill. So the revenue estimate shows, no loss to the general fund for the proposal. The fiscal note before you shows the amount that is estimated to be collected from the payroll tax, and then the estimated benefits. As far as any secondary impacts to business expenses, that is not reflected in the fiscal note or a revenue estimate.
Representative Anderson.
I think that will happen. So, and I understand, this is all last minute. I want to just make a comment. I know that the majority is gung-ho on doing something on this issue this year or next year, whenever. I would hope that we really look at the benefit formula, and it's not just the amount of weeks, but also the percent of income, because it is the highest by far out there. And my fear is that a lot of folks, because the benefits are so rich, that this is going to be very legally heavily used and taken advantage of, and it's going to do two things. It will bankrupt this program very quickly, very quickly, and it will also put a huge burden on businesses, government, schools, every entity that employs people to hold these jobs open, to try to find replacements when we don't have employees to fill the current jobs, period. I mean, was looking at the self-employed, the fact that self-employed can do this by paying into the system. If I was a self-employed person and I would find a seasonal job, a seasonal self-employment, which they exist everywhere, from construction to, summer work to whatever. You can work 3 quarters and find a sick, extended relative or friend or whatever to go take care of, and you can get paid for the 4th quarter. And even though your self-employment probably you wouldn't be working anyway in that quarter. And that is all legal. That's not someone doing something wrong. That's the way this is laid out. And so, if something's going to pass, I would just encourage that you start smaller. It's much easier to expand something than it is to have such an expansive program that I think is just a boondoggle, and then attempt to claw that back so we're not paying 10% in taxes, which I think is what this would end up being, the way this is laid out. So that's just my advice and thoughts to the author. So thank you.
Well, okay. Just would point out that, these would all be certified by a healthcare provider, but
That's
did you
very easy.
have anything, Representative Richardson, or should we go on to?
I think I would just want to lift up that when we're talking about the majority, we're talking about the majority of Minnesotans and the majority of Americans who want access to paid family and medical leave. 84% of Americans across political divides understand the importance of being able to care for yourself and to be able to care for others when you need to. And I think it's also important as we think about this bill as well, is within the United States, we are an outlier. Every other high wealth nation and low wealth nations have figured out how to offer access to paid family and medical leave. So surely we can as well.
Thank you. Representative Robbins.
Thank you, Madam Chair. Thank you, Representative Richardson. Unlike many people, I have not heard this bill in other committees, and I have been preparing for this, and I have a lot of questions, but I'll try to consolidate. So first, I just want to go back to Representative Anderson's question. Maybe someone on House Fiscal could address this. So the fiscal note clearly says that employers are able to deduct 50% of the annual premiums paid from employee wages. So why is that not reflected? Because clearly they're taking these deductions. So can we have that secondary impact, as you noted, modeled, or can we request that? I don't know if we're allowed to request that.
Ms. Templin, or I don't know if there's anybody from the department here who has any further comments on the revenue estimate, because that's sort of what we're discussing. Ms. Templin?
Madam Chair and Representative Robbins, I think that would not be, my understanding is that would not be something the Department of Revenue could model, but maybe perhaps DEED could model for their projections of benefits, or but I can follow up.
Great.
Yeah, I don't. That is an impact that I haven't researched before, and I would need to get more information about. But yeah, I apologize. I don't have a good answer right now.
Representative Robbins.
Thank you. It is in the deed section of the fiscal note, so maybe if someone from deed could just get back to me on that, I would appreciate that.
All right, sounds
Oh,
good.
maybe he's coming.
I don't know, he's coming up. Hello, welcome back, Deputy Commissioner.
Thank you, Madam Chair and Representative. No, that question has not come up in previous committee discussion, so that is not an element of the modeling. Again, the modeling here is an aggregate look at the OASDI wage information that we've received from the Department of Revenue.
All right, thank you. Representative Robbins.
Thank you. Can he hang on just for a minute? I think my other questions might be relevant for him. Okay, thank you. So kind of at the fundamental level, I have spent a lot of time on this fiscal note, and it shows 204,000 people estimated to take advantage of it, and the benefits is about 1 billion. But what I don't see in the estimates or the assumptions is the average weekly benefit that's assumed, or the average number of weeks assumed. So I can't see where you get these numbers. And I also don't see, just to piggyback while we're doing this, on how those assumptions change as you get into the out years, because the growth factors change, but I don't see how there's any sense of what you're assuming the changes in the benefit amount or the week amount is as it goes forward.
Deputy Commissioner?
Madam Chair, Representative. So I think perhaps page 10 of the fiscal note would sort of elucidates the overall approach to the modeling. We've covered as we've kind of discussed in other committees, but happy to give a recap here. The values in the fiscal note are derived from a United States Department of Labor microsimulation model known as the Worker Plus model. That model uses a variety of data inputs that are noted on page 10 of the fiscal note, including public microdata from a family and medical leave survey that the Department of Labor conducts annually, which includes a variety of data, not just related to FMLA, but also to the utilization of paid programs. It also uses U.S. Census American Community Survey data that is kind of specific to the state of Minnesota, and then there's a variety of inputs that we provide around that the department provides around kind of state average weekly wage, kind of presumed usage rates that are included on the top of page 11 of the fiscal note based on the experiences in other states with similar programs. The model, the Worker Plus model, then essentially basically consolidates those using those data sources as kind of the inputs, then provides an output around the estimate around including confidence intervals of the numbers of recipients, as well as the total benefits value that would be expected under the program. So the current version of that model does not actually have outputs that provides average number of weeks, and however, what we do is we obviously include state wage information around state average wages as one of the bases for the values that would be calculated out.
So we have 13 minutes left before we're done with our time. I have 5 people on the list. You can have one more question, but we've got to keep it moving here.
Okay.
Representative Robbins.
Thank you. And I would just like to say I would love to have a follow-up conversation with you, because getting the average weekly benefit assumption and the average amount of leave taken is critical to really understanding this. And the fact that they're not in the fiscal note, but somehow you maybe know them from what the model used but didn't include it in the fiscal note is troubling. But this, as was referenced, is an insurance product. And I'm very concerned that I have not found anywhere what the reserve requirement is, and the reserve requirement will affect the tax rate. So could you speak to what the reserve requirement is for this, Madam Chair?
Deputy Commissioner Rowe, I don't know if you're...
So Madam Chair, Representative, so maybe I can speak, and again, I think I'll let the bill language speak for itself. I think the bill has a mechanism in terms of premium recalculation that's related to a reserve requirement. I'm forgetting the exact page in the House file. Let's see if I can find a place. I think it's page 54. The government, and of course, and in terms of what is recommended in programs of similar nature, in Washington State, again, I think a very relevant example, a recent actuarial analysis recommended about a 3-month premium reserve.
Thank you, Deputy Commissioner Rowe. Representative Robbins.
Thank you, Madam Chair. So I did find that formula. I was looking at it earlier. But it says so first of all, just so the public understands, starting in 2026, I believe, the commissioner just gets to increase this tax amount. And it says the commissioner must multiply 1.45 times the amount dispersed. So does that mean that the rate of taxation could go up to 1.45?
Deputy Commissioner Rowe.
Madam Chair, Representative, no, that's not. That is not my reading of the bill. I think you'd want to look at the further subclauses 2 and 3 and 4. There's not this is really just kind of this is just a formula. The commissioner would actually have, as I read it, would have no discretion. Doesn't have discretion here. This is simply a mathematical formula derived from similar programs, mathematical formulas to ensure that the premium rate is set at a level that is, that is sustainable for the very purpose that you note, to ensure that there's an adequate balance in the fund.
Representative Robbins.
Thank you, Madam Chair. Again, I would like to discuss that formula in greater depth, so hopefully we can have that conversation later today or tomorrow. Are we adjourning or?
No. I mean, the meeting was noticed until 10:30. We have 2 bills on the agenda.
okay.
And so, there's an error on the agenda. We can take a little bit of extra time, but, I do appreciate that your last question was focused on the tax provisions. We can't really go into the full kind of discussion of all the provisions of the bill here. And as I said, I do have those other members. If you have one final question, Representative Robbins, but it sounds like there's the need for maybe some follow-up, because, if you want to get down into the formulas, we just don't really have time for that today. Representative Robbins.
Thank you, Madam Chair. And I do have several more questions, but I want to be respectful of the committee's time. So thank you.
Thank you, Representative Robbins. Representative Smith.
Thank you, Madam Chair. We've talked in this Taxes Committee a lot about Social Security and how successful a program it's been. The reason Social Security is a successful program is because at its core, it says that workers are not just valuable when they're working. They're not cogs of capitalism, but they are human beings who deserve dignity at all parts of their lives. In Social Security, that means when they're done with their working lives, their latter years, they get a paycheck so they can live that time with dignity. Before us, the paid family medical leave says that when workers have to take time off to have a child, to mourn a child, to care for their sick parents, or they themselves have an injury or have mental illness, they can deal with that. And they're still valuable. They still deserve dignity. They still deserve a paycheck. Social Security is wildly successful. In fact, so successful that I've heard all session about how not even the top 26% of earners should have to pay any income tax on that sort of income. How is Social Security funded? It's through a payroll tax. That is way higher than what we're considering here today. I think it's 12.4%, 6.2% for both the employer and the employee. Yet that's not killing our competitiveness. It is not causing people to just leave the workforce en masse. No, it's giving dignity to citizens of our society. Paid family medical leave is a 0.35%, 0.35% tax to make sure that when people have emergencies or when they're starting a family, they have dignity. That is a cost worth taking. It's not going to destroy our business industry. It is going to allow our workers to flourish in all aspects of their lives. Thank you, Madam Chair.
Representative Wiener.
Thank you, Madam Chair. Part of what we do here is we represent our people. Every one of us has a district. We're supposed to reflect our district and let the other people in this room know how a bill will affect our district. And we learn about the nuances, which is mentioned. Even every business is different. By listening in this committee, I thought my own area had the highest percentage of mobile homes until I find out Representative Norris's does. A little bit disappointed to come in second place, but that's okay. So in our area, my area, I grew up in, I've lived there almost my whole life. Minus a few years of going to college, starting my own family, starting my own business, my wife and I's business. I can't take all the credit. She is the brains. I'm just the pretty face out in front. But when we look at the employers in my area, we have very few, which would be considered large employers. The vast majority of our businesses start off and grow as a family-run business. Sometimes they're working for somebody else. They find their niche. Maybe it's fixing tractors, which they do on the weekends, afternoons, and that starts to grow. Next thing you know, there's a neighbor that says, hey, I got 5 hours in the afternoon. I can come help you. And that grows. Those employers are not just employing people that they don't know. It's their friends. It's their family a lot of times. And those small businesses is what has made our area productive. It really has. And they do an amazing job of taking care of each other. I've seen businesses who have nearly brought themselves to bankruptcy because of an employee or a family member that they took care of. They helped out. This is not an evil structure that wants people who are going through a pregnancy or a sickness, that they want to punish them. That's not the case. That's not what I see in my area. They have dignity. They want to treat each other with dignity. And the word gets around when you have a good employer, when you are a good employer, you will know very shortly, if you're looking for a job, you want to go work for that person. That's a good person to work for. That's a good family to work for often. It means something because that business can offer is a key thing here, I think. That used to be a recruiting tool for businesses. We can offer something better. It's been mentioned by some of the testifiers that their business is offered, or as a business owner, they offer this. And
I just learned that Representative Richardson needs to leave at 10:30, so we gotta, I'm sorry if we could.
Sorry, normally I'm pretty short on these things.
You are, I'm sorry, I didn't mean to interrupt you, Representative.
So when I look at this, and I'll try to wrap it up, I look at this bill, and instead of government mandating to these businesses, because we've heard from NFIB and I forget the other one, that this will hurt small businesses. This will hurt my area. Instead of government dictating that we have to do this, let the employers opt into the system. Let them say, I want to offer this to my employees. I want to do this for them. Let that business decide, because it is very difficult when you are looking at your numbers and deciding, okay, we're going to do this, this, and this as a business owner. We've talked about the nuances. Every business is different. You could have 3 employees and be a lawyer's office and be very successful, where if you're a small business working on tractors on the weekends, it's very tough. I suggest that we offer this as an opt-in. Give those business owners the option to offer this to entice employees. Thank you.
Thank you. Very briefly, Representative Koznick.
Thank you, Madam Chair. There's been discussion, I've heard this bill a couple of times. With the payroll tax deduction on here, we've asked to have caps on there, or even periodic caps. I used to do mortgages, we do adjustable rate mortgages. They went, businesses that are being forced to do this it may help them if they know that there's a cap to the next payroll tax. It's not going to go up more than a certain amount. It's not going to go up more than the salary, which would actually be quite disastrous. Are you open to putting these caps on there? Can you tell us, the committee, this is the 5th, 10th stop? Been working on this for a while. It's not a new concept. Are you open to that?
Got you. Representative Richardson.
Thank you, Madam Chair. And as there is a cap in the Senate, that will definitely be a discussion in conference committee.
Okay, I appreciate that. I know you're.
Representative Koznick, do you have another tax-related question that's very quick? Like, we're at the end of our time here. We have another member who needs to talk.
I understand. We should hold off on this until we actually, doesn't make sense to do an actual actuarial study after we pass the bill, figure out how expensive it's going to be.
Okay.
And then also, members, you should check with your cities, counties, and schools. We can have that discussion because in my area, I've checked and it's about $1 billion.
Thank you, Representative Koznick. Representative Pinto.
Thank you, Chair. I'm pretty fired up, but I think given the timing, Madam Chair, maybe I will save it for the floor. Yeah, thank you, Chair.
Good.
Appreciate it.
All right, Representative Richardson, closing comments for us.
Thank you, Madam Chair, and thank you, members, for the discussion as well. You know, I want to clarify for the record that there's been extensive modeling that has been done using the Department of Labor Resources and also the work that was done at the Institute for Women's Policy Research at the University of Minnesota. So I've been describing the actuarial study as a boots and like a belts and suspenders type of approach as we're moving through. And I just want to briefly talk about the opt-in piece of this because that's the system that we have right now. Individuals have the ability to opt into this. And with that structure, what we see is incredible disparity in terms of who has access to paid family and medical leave. And I think that I think it's important that we have a more even safety net that's not being determined upon what someone looks like or their gender or their race or being low income. And I think it's also important that we talk about the costs of inaction as well, because they're great to our state, not only financially and economically. Access to paid family and medical leave reduces reliance on public assistance. It keeps people within the workforce. It reduces infant mortality, maternal mortality. Preterm births are decreased. Low birth weight babies are decreased as well. And the cost of long-term care are decreased. So there's lots of financial benefits and frankly human benefits that come from seeing people's humanity. So thank you, Madam Chair, for the opportunity.
Thank you very much, Representative Richardson. So the chair renews her motion that House File 2, the fifth engrossment as amended, be re-referred to the Ways and Means Committee. A roll call has been requested. And so, Ms. Sabas, please take the roll.
Chair Gomez.
Gomez, aye.
Gomez, aye. Vice Chair Norris.
Aye.
Norris, aye. Minority Lead Davids excused. Representative Agbaje. Agbaje, aye. Representative Anderson.
No.
Anderson, no. Representative Brand.
Yes.
Brand, aye. Representative Elkins.
Aye.
Elkins, aye. Representative Howard.
Aye.
Howard, aye. Representative Joy.
No.
Joy, no. Representative Koznick. No. Koznick, no. Representative Lee. Aye. Lee, aye. Representative Listlegard, excused. Representative Olson B.
No.
Olson B, no. Representative Olson L, excused. Representative Pinto.
Aye.
Pinto, aye. Representative Robbins.
No.
Robbins, no. Representative Smith.
Aye.
Smith, aye. Representative Swedzinski.
No.
Swedzinski, no. Representative Wiener. No. Wiener, no. Representative Whitty. No. Whitty, no. Representative Uakim.
Yes.
Uakim, aye. Madam Chair, there being 10 ayes, 8 nays, and 3 members excused.
There being 10 ayes and 8 nays, the motion prevails and House File 2, the fifth engrossment, as amended, is re-referred to the Ways and Means Committee. Thank you very much, Representative Richardson. All right, so we're just gonna do this, pass this vehicle bill, hopefully. Thanks for understanding the time constraints that Representative Richardson had, members. I wasn't trying to stifle conversation. As you know, I like talking to you guys. Most days. Today, I don't know, we'll see. So I'm gonna move that House File 1372 be re-referred to the General Register. So this is the DOR policy bill that we heard back in February. Contents of the bill are also in the House tax bill that we passed out of committee yesterday, with the exception of that we took Representative Robbins's version of the stillbirth credit instead of the department's language. So this is basically a vehicle bill if we need it. So yeah, I'm going to move that it be re-referred to the general register. Is there any discussion to the motion? Representative Swedzinski.
Madam Chair, just to, if this does get and move off the floor, it is our hope that 100% Social Security tax relief is amended to it. Thank you.
I understand your hope. Hope it feels good to hope. All right, all those in favor, please say aye. Aye. All those opposed, please say no. Motion prevails. House File 1372 is re-referred to the general register. So this is our last meeting of the tax committee. They said finally. Oh, see, I thought we were having fun together here, you guys.
Feels good to hope.
Have I said we were at our last meeting before today? No. I don't think so. It's just always, yeah, it's been a long week, so we really appreciate everybody. Sorry we've been here at 9 every morning, but just really briefly want to thank our staff. We want to thank our revisers, Maureen Sandy and Evan Powell, who are not always here with us in this room, but they work so hard and help us make sure that our bills are all together. Our incredible House research team, Sean Williams, Chris Clayman, Alex Hagler, Justin Cope, and Jared Swanson. Thank you so much. You guys are amazing. And I think we all, everybody in every committee thinks their nonpartisan House research staff is the best, but we're right. Our nonpartisan House research staff is the best. Our House fiscal analysts, Kathy Schill and Cynthia Templin, thank you so much. We'll just clap for you guys. We'll clap for all our nonpartisan people. All right. We have a Humphrey Fellow that's been helping us, Carly Ekstrom. Our amazing pages, Nash Boone and Joe Schatz, thank you. You guys are do a great job. Our partisan researchers, Kelly Cavanati and Sean Haydorn, thank you so much for all of the ways that you support us all. Really appreciate it. The Sergeant at Arms, I don't, thank you everyone. Our CLA, Lauren Savis, who keeps everything rolling. And of course, thank you, Lauren. And of course, Patrick McQuillan, who sends us all emails, sends us all documents, helps me out whenever I'm falling apart. Thank you so much, Patrick, for everything that you do to make everything happen. This, it's obviously, it's just a really great honor to have been entrusted with this position. And I want to thank all of the members because, I think that one of the taxes is the best committee. We don't just have the best staff, we're the best committee overall. And one of the reasons for that is because we're able to really dig into what matters in our state and kind of to unearth and work through a lot of the places where we're fundamentally we're all here to help people. We're all here to do good for our communities, but we have different approaches and we have different philosophies, and we're able to unpack that here, to go through it and to do so respectfully. And I am just immensely grateful to all of you for all of the attention and all the ways that you've showed up and that we've been able to have a really great, respectful conversation. And he's not here, so don't tell him I said anything nice about him. But just Representative Davids, obviously, I am very appreciative of all of the ways that he has kindly leaned over and said, Madam Chair, you got to say the actual motion, and all of the other ways that he's supported me personally, and the leadership that he's provided to the team. And as a relatively new member, I just very much appreciate the way that he brings forward kind of the good things about this institution and the good things about the ways that we can function together and that a committee can be run together. And so just my immense gratitude, and we'll be seeing a lot of each other, obviously, over the next couple of weeks. So, all right, with that, wait, what? Oh, Representative Robbins.
Thank you, Madam Chair. I just wanted to say thank you to you for your leadership. We speaking for our side, we really have enjoyed the committee. We have all learned a lot together. We appreciate the opportunity for very robust dialogue and debate with all of you. I think, this committee is fun, and it's a lot of hard work, but we really, I think, get to the root of a lot of important issues for the body. So I'm grateful for your leadership and your openness to always meeting with Lee Davids and myself and others. You're always very accessible and willing to listen to us, and we're very grateful for that. And obviously, we want to give the same tremendous gratitude to our staff. Like, you guys are phenomenal.
Yes.
We obviously couldn't do any of this without you, let's be honest. So we just express the same gratitude and thanks, Madam Chair.
Thank you so much, Representative Robbins. That's very kind of you. All right, everybody, we'll see you on the floor in a little while. And with that, we are adjourned.